Hey friends, welcome back to Align Vitality. I'm Tanya Angus-Heather, your host, and I want to talk about something that I think many of us kind of quietly live through, and yet it doesn't always get talked about in a real honest and helpful way. And that is when you know something is off in your body, but not getting clear answers, not having a diagnosis, not having a treatment plan that really explains the whole picture, and not having maybe the quick fix that you're hoping someone would hand you. My husband and I recently spent some time at the Mayo Clinic because he's been dealing with chronic lung issues and sinus issues for honestly several years now. Years of frustration. He had a couple of winters where he was literally almost was coughing for 3 months straight, both winters. He's been searching for answers, trying to get tests that were largely inconclusive, or at least not conclusive enough to point to a clear diagnosis with a neat little treatment plan attached. So if you've ever walked through something like that yourself or with someone you love, you know how draining that can be, because in his case, you're not breathing well, when you're coughing incessantly for months, when you're never really fully feeling well for very long, it can be really scary. It is emotionally and physically exhausting. And honestly, it can create a lot of anxiety, because when you don't feel well and no one can give you a clear explanation, your mind starts to spiral. You start wondering, what if this is something really serious? What if they're missing something? What if this is never going to get better? What is this just how my life is going to be now? And I watched him wrestle with that. I've also watched the frustration that comes in looking for an answer, something tangible, something clear, something that can just be fixed, and the answer doesn't come. So today I want to talk about what the Mayo visit actually confirmed, not just for him, but honestly for me, in what I've been learning and saying from a holistic functional health standpoint, because in so many ways it confirmed what I've been saying and learning all along, although I've tried to measure my approach with him. But I think there's something here that really matters for all of us. Do you want to recharge your energy, restore your mental clarity, and finally feel like yourself again? Well, you are in the right place. Welcome to Align Vitality, the podcast that offers faith and functional health strategies for high-achieving, health-conscious women in midlife who want to heal from chronic stress, body and spirit. I'm your host, Tanya Angus-Heather, a certified functional health practitioner, Christian life coach, and fellow midlife woman who knows what it's like to look strong on the outside while struggling silently on the inside. Here, we get real about anxiety, brain fog, burnout, hormone shifts, and the hidden toll of chronic stress. And more importantly, we talk about the path to healing. Each week, you'll find practical strategies and faith-fueled encouragement to help you restore your God-given energy, calm your nervous system, and reclaim peace in this season of life. If you're ready to stop pushing through and start thriving in the abundant life you were created for, let's get after it. This is Align Vitality. I think one of the hardest places to be is this in-between place with our health, not diagnosed with some clear chronic or acute illness, but not well. Not really in crisis exactly, but you're not okay either. And I think this is where many people find themselves. They're symptomatic, they're tired, inflamed, foggy, maybe they're short of breath like my husband, anxious, not recovering well, just not feeling like themselves. Because the testing doesn't always point to some obvious disease process, they're often told some version of everything looks okay, everything looks normal, we're not seeing anything alarming, there's nothing major here. And while that is and can be good news in one sense, it can also feel incredibly defeating. Because if you don't feel okay, hearing that nothing obvious is wrong does not necessarily bring relief or reassurance. sometimes it just makes you feel more confused. And I think that's an important thing to say out loud. The absence of a diagnosis does not always mean the presence of health. Now, this doesn't mean that conventional testing is bad. It's not. Conventional medicine is incredibly valuable. It is often very good at ruling out serious pathology, major disease, and dangerous structural and physiological problems. And that matters. It's important. I'm very grateful for that. But what conventional medicine is not always designed to do is help someone build health in the phase that comes before disease, when disease is not yet diagnosable. It's often much better at identifying illness than it is at helping people understand the long, slow brewing of unwellness. And that is where I think functional holistic health brings so much value, because in functional health, we ask a different question. We don't ask, what disease do you have? But instead, why is your body struggling to function well? That's a very different question. So, going back to the Mayo Clinic visit, after all the evaluations and the consultations, what it really came down to was this. The good news was that there was not a clear chronic disease diagnosis for my husband. But the hard news was that there also was not a pill, a procedure, or a treatment that was going to simply fix everything. And I think that that was both relieving, but honestly more frustrating for him at the same time. Because relieving, of course, because we were thankful that there was not some clear, devastating diagnosis, and I tried to reassure him with that reality, but frustrating because what my husband really wanted was an answer with a quick fix. And honestly, who wouldn't? When you've been suffering, you want relief and you want it now. When you've been scared, you want certainty. When you have been uncomfortable for a long time, you want someone to tell you exactly what to do so it goes away. That is human. But what Mayo really confirmed was something much more foundational. If my husband or any of us wants to be healthier, he's going to need to make lifestyle changes that reduce inflammation, support his metabolic health, improve his sleep, reduce his stress, and gradually build health. In other words, nutrition, movement, supportive sleep, stress reduction, consistent habits that lower the inflammatory burden and support the body's ability to function the way that it was designed to function. Literally all of the things that we talk about here and in the holistic functional health world. And I just sat there thinking, yes, exactly. Not in an arrogant way, not in an I told you so way, but in a deeply affirming way, because it reinforced something that I've been more and more convinced of. And that is that unwellness is often brewing long before disease gets a name. But that's also the period where we have an opportunity to reverse course. The, I guess, fortunate and unfortunate reality is, however, it involves consistent lifestyle choices day after day, the simple small steps that build health. So in reality, it puts the responsibility and the ownership back on us to build our own health through consistent daily lifestyle choices. Now, this is one of the biggest things I want people to understand. The body often gives signals long before there is a diagnosable illness. It's not alarmist, it's actually hopeful, because it means there is often a window, sometimes a very long one, where we can start paying attention and supporting the body before things progress further. In functional health, we are trained to look upstream. So asking, what is driving the inflammation? What is burdening the system? What is depleting our resilience? What is disrupting the body's ability to repair? And what is keeping the body from healing well? And most often the answer is not one big dramatic thing. It is years of cumulative burden, chronic stress, poor sleep, processed foods, blood sugar instability, inconsistent or low levels of movement, chronic sympathetic or fight or flight activation, emotional strain, inflammatory load, maybe environmental exposures, maybe gut issues, almost always gut issues. And often, because of those gut issues, nutrient depletion. None of those things may immediately show up as a clear disease, but over time they shape the terrain, and eventually that terrain begins to show up as symptoms. So when someone is dealing with chronic sinus or lung irritation, inflammation, fatigue, immune vulnerability, anxiety, and a body that just is not bouncing back the way it should, I think we have to zoom out and look at the bigger picture. Not just what is the lung diagnosis, but what has this body been living under for a very long time? That's where the real insight often is. And this is where I want to be really compassionate, because I understand the desire for a quick fix. Like I said, I very much understand the desire for a quick fix. I really do. It is easy to talk about foundational health when you're not the one coughing for months or waking up every day wondering if you're going to feel terrible again. When you're in it, you want relief. And I don't think that desire is wrong, but I do think it can create a trap. Because we live in a culture that is very used to symptom management, very used to what can I take? What can I do quickly? What can make this stop right now? And again, there is a place for symptom relief. I am not at all anti-medicine. I mean, I work in healthcare. I am not anti-treatment. I am not anti-doctor at all. But what I am saying is this: the Band-Aid is not the same as healing. Sometimes it is necessary. Sometimes it buys time, and sometimes it helps reduce suffering. But it is not the same as building health from a foundational standpoint. And building health is often slower, less dramatic, and much less exciting than a quick fix. It looks like going to bed earlier, reducing your intake of inflammatory foods, eating enough protein, walking consistently, getting sunlight, regulating your stress, supporting the nervous system, doing the basic things that most people do not want to do consistently until they are desperate. It's not sexy, but it is often what works for the long haul. There is a difference between wanting to be healthier and being ready to consistently live in a way that builds health. And I think my husband is in that wanting phase. He knows he wants to feel better. He knows he wants to be healthier. I find myself in these places time to time. I seem to have ups and downs where I'm more or less committed to my own health building. My husband knows the way that he's been living is not going to produce the outcome he wants long term. He knows it. But when the whole picture feels overwhelming, it is very hard to fully engage. I think that's realistic, and it is so very human, because when someone says, you need to improve your nutrition, you need to reduce your stress, you need to sleep better, you need to exercise more, you need to lower your inflammation, you need to support your metabolic health, that can feel like, well, great, so I need to become an entirely different person by next Tuesday. That kind of change feels impossible when you look at it all at once. And when people feel overwhelmed, they often either shut down, look for the shortcut, or do nothing because the whole mountain feels too high. I think a lot of you can probably relate to this. You know what you should probably do, but the whole picture feels so big that you don't know where to start. And when you do not know where to start, it is easy to stay stuck. So I think it's really important to say this. Being in the wanting phase isn't failure, it is part of the process. But you do eventually have to move from wanting to beginning. And this is where I think the functional health approach is so helpful when it is done well, because the answer is not to dump the whole mountain on someone. The answer is to identify the next small, meaningful step, not the perfect plan, the next step. That might mean just starting with breakfast where you get more protein, or a 10-minute walk after dinner, or start going to bed 30 minutes earlier. Start getting some morning sunlight in your eyes. Start reducing your intake of alcohol. Start with one breathing practice before bed, or better hydration, or just ask yourself, what is one thing I can do consistently this week? And then once you have success with that, stack the next thing on top of that. That is how real change happens. It usually doesn't happen through one giant dramatic overhaul. It happens through small pieces that build on each other. It's not glamorous, but it is realistic and it is possible. And realistic is what people actually need, because once you build one piece, you create a little momentum. And momentum makes the next piece feel more possible. I think that's one of the biggest things I'm trying to help myself and other women understand in the work that I do. You don't have to do everything. Just start somewhere. And honestly, I think this is true when it comes to our spiritual health also. God usually does not hand us the full staircase. He gives us the next step, the next act of obedience, the next layer of surrender, the next thing to trust Him with. And I think that is a sign of His great mercy. Because if He showed us the whole road all at once, most of us would panic. Instead, He just invites us to walk with Him daily, faithfully, step by step. And I think healing often works that way too. We want the full answer, the full plan, the full guarantee, but often what we get is the next right thing. That's true in health, and that's true in faith. And maybe that's enough for today. Maybe your next step is not to figure out the whole picture. Maybe it is just to ask, what is the next right thing that honors the body that God gave me? That's a very different question than how do I fix everything right now? So what do I hope you take away from this today? First, if you know something feels off, don't ignore that just because you do not yet have a diagnosis. Pay attention. Listen to your body. Symptoms are signals. Second, do not lose hope if there is no quick fix. The absence of a dramatic answer does not mean there is no path forward. Sometimes the path forward is just more foundational than you want it to be. Third, do not let the whole picture paralyze you. If building health feels overwhelming right now, pick one small place to begin. Just one. That's enough for now. And finally, do not underestimate the power of consistent lifestyle change. It may not feel dramatic, but over time, it is often the very thing that prevents, slows, or even helps reverse the deeper breakdown in our bodies and can actually prevent disease. That matters a whole lot. If this episode resonates with you, maybe because you've been in that in-between place too, not diagnosed but not feeling well, not in crisis but not thriving, I just want you to know you're not crazy and you're not weak and you are not alone. Sometimes the body is telling the truth long before labs catch up, especially traditional labs. And sometimes the invitation is not to wait for a bigger problem. It is to start building health right now, not in fear but in wisdom. And if you're in the wanting phase, that's okay. Just do not stay there forever. Start with the small pieces. Build gently, build consistently, and trust that those pieces matter because they do. I want to thank you for listening today, and I'll see you back on the show next week. Thank you so much for joining me today, my friend. If today's episode encouraged or blessed you, would you please take a minute to leave a rating and written review on Apple Podcasts? It means the world to me, and it helps more women like you discover this message of hope and healing. If you're ready to take the next step in your functional health journey, join my interest list at alignvitalityhealth.com. And remember, this podcast is for educational purposes only. It is not intended to be medical advice, nor is it intended to diagnose or treat disease. Please consult your healthcare provider before making changes to your health. Until next time, I'm Tanya reminding you that healing is possible and your best season is still ahead.